84.
All right, just about 8.5 minutes before 10 o'clock, just a short period of time to talk about something really important, and hopefully we'll have information so you can get more information. Do you know anything about Lyme disease at all? The symptoms, the signs, anything at all? Dr. Richard Horowitz is on the phone. He's a board-certified MD specializing in internal medicine, a pioneer in Lyme disease research, and he's the co-founder of the Hudson Valley Healing Arts Center in Hyde Park, New York, speaking about Lyme disease. He's got a book called How Can I Get Better? An Action Plan for Treating Resistant Lyme and Chronic Disease. Good morning, Dr. Horowitz.
Good morning.
Where are you right now?
Hyde Park, New York, Hudson Valley.
Well, thank you for being on. Okay, what is Lyme disease? Let's start with something easy or
right.
simple.
So it's a bacterial infection that you get from the bite of an infected tick. The tick can be on for actually a couple of hours. You can get Lyme disease, and it mimics a whole host of different diseases. It can look like chronic fatigue syndrome, fibromyalgia, autoimmune diseases like rheumatoid arthritis and multiple sclerosis. You can get psychiatric problems like depression, anxiety, even schizophrenia, and it can even look like early dementia, Alzheimer's. So it's the great imitator.
Really?
And the problem is, it's spreading throughout the United States. The CDC reported there's a 320% increase in the number of counties, tenfold increase in cases. A lot of people are coming down with it and don't know they have it.
My goodness. Can somebody who has Lyme disease from a tick give it to somebody else without that second person having a tick bite?
Well, that's a great question. Sexual transmission has been discussed as a possible cause, but it's not really proven at this point in time. It can happen, but we do know that a pregnant woman can pass it on to her child. Some of these tick-borne infections, the ticks don't just contain Lyme. They contain parasites like Babesia, which is like getting malaria. They contain Bartonella, Anaplasma.
Wow.
So some of those are in the blood supply. So you could also get a blood transfusion.
Is there any way of knowing, are the ticks in Florida more likely or less likely than the ticks would be in New York, or are all ticks created equal in this regard?
No, there are different infections in the different ticks, so you'd have to check with the local Florida health departments to find out what you've got in your area. But, for example, in my area, 70% of the ticks are infected, and they have Lyme, they have relapsing fever, Babesia, Powassan virus, Anaplasma.
Oh.
Yeah, I mean, they're basically containing a whole host of infections. So we do have patients, by the way, from Florida who come to see me who can't get help because because the doctors don't think there's any going on in Florida, and there are people who do get sick.
Oh, my gosh. So I don't know if this is a dumb question or not, but does it matter what part of your body the tick got to? And the reason I'm asking this is because I knew a young girl. She wasn't even 10 years old, and she started being lethargic. Long story short, her mother found a tick at the base of her neck, and they removed the tick, and it got better. So the tick, maybe it wasn't the disease, but as much as the tick, I don't know. I don't even understand what happened there. But, okay, so that's my question. Does it matter where the tick bite is?
Well, in certain cases, yes, because you need to find the tick. There's actually a type of a paralysis you can get from ticks, which is in the back of the head and the hair, called tick paralysis. It's a toxin in the tick. It can paralyze you, look like Guillain-Barré syndrome, where you have an ascending paralysis. You can't walk or speak and die. And there are young kids, actually, who can die from tick bites with these toxins. But if you get a tick bite any place in your body, they found that the organism can disseminate very quickly throughout the body, get into your brain even within 24 hours. So even if you catch it early and you see the classic bullseye rash, which only about 25% of the people get in the U.S., it'll still get up into your brain fairly quickly, and not in all cases, but in some. So people really have to have a high level of kind of looking for this disease if you have an unexplained chronic fatiguing musculoskeletal illness where you have memory, concentration problems, migratory pain that's moving around your body, and you just can't figure out why.
Oh, my gosh. Does the bullseye rash happen at the tick bite, or could it happen anywhere?
Usually it does happen at the tick bite, but there are people who will get several types of bullseye rashes all over their body. That means that it's disseminated throughout the whole body, and that usually 30 days of antibiotics are not going to cure that up. You need a much more aggressive course if you get several bullseyes.
So when a person goes to the emergency room and they're just not feeling right, all of a sudden they're just very fatigued and they feel like they're going to be ill, are the emergency room doctors equipped with knowing that it could be ticks and Lyme disease could be setting in?
Well, yeah, I think most may know about it, but the problem is that the blood tests are not reliable. So if they're using standard CDC protocols of using what's called an ELISA test, ELISA, that test only picks up Lyme in about 50% of the cases. There's 100 different strains of Lyme disease in the U.S. You can't expect a test that picks up one strain to pick it up. And you've got actually a great researcher in Florida, Dr. Kerry Clark at the University of Florida. He's done some amazing research on Lyme, not just in Florida, but in Georgia, surrounding states, the Midwest, where he found there are different species, and that's why we've not been able to pick it up. So an ER doctor has to know that the tests are not reliable, and that it is a clinical diagnosis.
The book is called How Can I Get Better? An Action Plan for Treating Resistant Lyme and Chronic Disease. Dr. Richard Horowitz is the author of the book. I have a copy of the book, so let me offer it to one of our listeners. If you'd like the copy that was sent to us, you can call me and I'll leave it here for you. The rest of us will have to buy it. Doctor, can you direct us to a good place to buy the book?
Sure. It's on Amazon.com. It's on BarnesandNobles.com. All the major booksellers at this point should be carrying the book. So the book's been out for several weeks. You should find it either on the online sites like Amazon, Barnes and Nobles, but it's easily available.
Do you find people buying the book, putting it on the shelf, saying, just in case? Just in case I know somebody, because right now I don't know anybody with those symptoms, but the summer's coming up. We have a lot of ticks here. For the local listeners, let's see, Juniper Springs, I never come out of Juniper Springs without a tick. I always have a tick. Couple of places.
So the problem is that 3.5% of the American population has been diagnosed with chronic fatigue syndrome, and 1.5% of the U.S. population has fibromyalgia. Well, those symptoms of chronic fatigue, fibromyalgia, of fatigue, joint, muscle pain, memory problems, sleep disorders, there's no test for chronic fatigue or fibro. That, in my case, when the people come to see me, it's usually Lyme and other tick-borne disorders. So, even if you don't think you have it, the reason to get the book is because there's a questionnaire in the beginning of the book, and if you score high on that questionnaire over 63, you've got a high probability of having it, because even if you didn't get it in Florida, people travel all the time to other parts of the United States and Europe, and it's highly endemic. At this point, it's the number one vector-borne spreading epidemic worldwide.
Really? So even if the tick is removed, how long does it take to get better on its own, or does it get better on its own?
People have reported to me within a couple of hours of a tick bite that you can get Lyme disease, and there are certain other tick-borne infections like relapsing fever Borrelia. You can get it within 5 minutes. Rickettsial infections like Rocky Mountain spotted fever, you get it within 10 minutes of a tick bite. Powassan virus, which is a viral infection, you get within 15 minutes. So you can get these infections quickly, and you've got to remove those ticks as quick as you get them.
Wow. Doctor, good information, really good delivery in such a short period of time. Thank you for being on the air with us. And we have recorded this interview. We encourage our listeners to share it with somebody who can benefit from it. Thank you, Doctor, for being on the air with us today.
Oh, my pleasure.
We'll be right back.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
Fox News Radio, I'm Karen McHugh. The House gets to work getting rid of the Affordable Care Act.
As President Trump said, this is his plan. No more excuses, no more fiddling around. Right. Today, in the Ways and Means Committee, after 7 long years of fighting and working and waiting, today we begin the repeal of Obamacare.
Texas GOP Representative Kevin Brady on Fox and Friends. Investigators probing Tuesday's fatal train bus crash in Biloxi, Mississippi.
NTSB board member Robert Sumwalt says they'll be looking at a number of things, including rail and highway factors, motor coach operations, and recorders. 2 people